Hi guys, good morning everyone. Welcome to our YouTube channel Nursing Update. So this channel is only meant for graduate nurses who are looking for a job in India and out of India, means in foreign countries. So yesterday we have discussed about the opportunities. Okay, if you didn't watch the video, I have shared the link of that video in the description box. Please do check that. Okay, let's move on to the today's video. Okay, today we'll discuss some of the MCQs in psychiatric nursing. Yesterday itself I mentioned my favorite subject in nursing is psychiatry. So let us discuss 10 MCQs with rational in psychiatric nursing. Okay, so if you are new to our channel, please subscribe, like our video and share with your friends. Okay, let's move on to the question and answer. So first question, delusion is a disorder of mood, thought, affect and perception. Okay, so what is delusion? You should know what is delusion, then only you can answer the question. Okay, delusion means false fixed belief. Okay, what is false fixed belief? Suppose I am having a belief that Virat Kohli is my roommate. Okay, that is known as delusion. Okay, so this thought is comes as a result of thought. As I already answered this question. It's a disorder of thought. Okay, so I am giving one assignment for you. What is the difference between mood and affect? Okay, let me know in your comment box what is the difference between mood and affect. So I will be sharing that answer in my next video also. Okay, so delusion is a disorder of thought. Okay, this is one of the most frequent MCQs. I have personally seen more than 3 or 4 exams this question have came. Okay, coming to the second MCQs. Mental Health Act passed in 1982, 1985, 1987, 1986. So if you see any of the question paper, means government competitive exam question paper, there will be at least one question related to the years. Okay, they may ask Mental Health Act passed in, Mental Health Program passed in, Board Committee was constituted in the year. Okay, schizophrenia was discovered in the year. Like that, many of the questions have came in exams, especially related to the year. Okay, that too, if you take psychiatry, this is the most frequent MCQ is Mental Health Act and Mental Health Program. Okay, Mental Health Act is passed in which year? Mental Health Program is passed in which year? Often we get confused. I hope if you are in preparation, you will get confused with two options. One is 1982 and one is 1987. Okay, so we know very well 1985 and 1986 are not answer. So between these two, which one is the answer? 1987. Okay, so to be more specific, mental health program. Okay, mental health program was started in 1982. Mental Health Act was passed in 1987. Okay, so we'll move on to the next MCQ. Fear of being alone in open space is known as. Actually, what is fear of fear? Irrational fear is phobia. Okay, the question is related to the phobia. Okay, so a person is getting fear for being alone in an open space. The options are agoraphobia, acrophobia, gamophobia and claustrophobia. Okay, so let we discuss one by one phobia. Okay, phobia, you have an idea what is phobia? Yes, it is irrational fear. What is claustrophobia? Claustrophobia means fear in closed spaces. Okay, what is gamophobia? I hope everyone will be having this phobia, that is marriage. Okay, fear of marriage. Acrophobia, what is acrophobia? Fear of height. And agoraphobia is fear of being alone in open spaces. Okay, so this is one method of learning. Okay, if I learning a question, for example, fear of being alone in open space is agoraphobia. Yes, that's well and good, but we can generate three more questions from this question itself. Okay, what is fear of being means a person is getting fear if they climb in high altitudes. What is the term used to denote that? That is acrophobia. Okay, fear of marriages is fear of closed spaces. Okay, so among these two, most frequent MCQ they have asked is uh, fear of being in a closed space, claustrophobia, and this MCQ, fear of being alone in open spaces. Okay, so I have already told the answer. Fear of being alone in open spaces, agoraphobia. Then Johari window blind spot is first quadrant, second quadrant, third quadrant, and fourth quadrant. Okay, so many of you have an idea about Johari window. Some may not know about Johari window. Let me explain Johari window. Okay, leave the word Johari. Take window. What is window? Window means it will be there in our house, right? Window means through which we can see outside, and from outside also they can see what is going in inside. Okay, that is window. So the person named Johari, he mentioned a particular thing, okay, about a person, that is known as Johari window. Okay, it has four quadrant. Okay, four quadrant: known to self, known to others, unknown to self, unknown to others. Okay, it will be little bit confusing. Let me take myself as an example. Okay, so there are certain aspects or certain things about me which is known by me and known by you. Okay, so there are certain aspects which is known only by me, not for you. Okay, but there are certain aspects which you know about us, you know about me, but I won't know about myself. Okay, that is known as known by self. Known by self means I know about myself certain things or certain characters. Okay, known to others means certain characters you people know about me. Okay, unknown to others, certain things are not known to you, that is unknown to others. Unknown to self, certain things are not known by my itself. Okay, myself, that is known as unknown by self. Okay, so it has four quadrants. This is also an MCQ. Johari window contains how many quadrants? Okay, it has four quadrants. Okay, let us go to the first quadrant. What is open quadrant? Open quadrant means known to self and known to others. Okay, so there are certain characters which is known about me, which is known by myself, okay, and by yours. Okay, that is known as open quadrant. Okay, second quadrant is blind spot. What is blind spot? If when you are telling a person as blind, when you tell a person as blind, okay, he can't see, but others can see him. Okay, that is what this quadrant means. Okay, unknown by self. There are certain aspects of me or certain characters of me which is not known by self, but you people know about me. That is known as blind spot. Okay, third quadrant is hidden. What is hidden? Hidden means you hide something. Okay, so the name itself indicates what is hidden. There are certain aspects which you know about yourself, but others don't know. Okay, that is known as hidden. And there are certain aspects which none of us know, that is known as unknown to all. Okay, open to open, blind spot, hidden, and unknown. So the question was Johari window blind spot is second quadrant. Okay, so coming to the next MCQ, Pavlov experiment is an example of operant conditioning, classical conditioning, learned helpness, and modeling. Okay, so today's video we'll see what is this. Okay, what Pavlov did. Okay, so what he did, he had a dog. Okay, he used to feed that dog. Okay, so then he practiced the dog to give food with a ring. Okay, so whenever the alarm presses, he gives the food. Okay, after it has been given for a few days, few months. Okay, after a few days, the dog, whenever it's hearing the alarm sound, it started salivation. Okay, that is the experiment he did. What he wants to convey us is behavior can be manipulated. Okay, when your salivation will start? When you see a food, right? So, but he is combined that food with a alarm. Okay, so now what our brain started to recognize, whenever alarm comes, the food will come, so it will started salivation. Okay, so Pavlov's experiment is classical conditioning. Okay, so that's all about classical conditioning. There is one more conditioning we have seen, that is operant conditioning. In my next video, I will be discussing about the operant conditioning. Okay. So coming to the next question. A nurse during a course of treatment develops positive or negative feelings towards the patient. The terminology is empathy, sympathy, transference and counter transference. So what the question is telling us, a nurse is there. Okay, a patient is there. Okay, suppose consider me as nurse. Patient is there. I am developing some sort of feelings. Either it will be positive feeling or negative feeling. What is positive feeling? I am feeling some good feelings about them. Okay, or so I am feeling some hatred towards the patient. That is negative feelings. Okay, so that process is known as, the term used to denote that process is known as counter transference. Okay, so the answer is counter transference. So what is transference then? Transference means patient is developing some sort of feelings towards the nurse. Okay, nurse to patient, counter transference, patient to nurse, transference. Okay, so please don't get confused. Remember, whenever the nurse is developing, means take ourselves as example, whenever nurse is developing a feelings, that is known as counter transfer. Whenever the patient is developing the feeling, that is known as transference. Okay, coming to the next question. The term used to denote intracyclic conflict symbolically to physical symptom is dissociation, conversion, sublimation and intellectualization. What are these terms? Actually, these are defense mechanisms. What is defense mechanism? So whenever a person is having some mental stress, okay, how they are reacting to that stress, okay, that is known as defense mechanism. So in that many types are there. We'll discuss one by one with question or with an example. Okay, so what they are conveying in this question, the term used to denote intrapsychic conflict symbolically to physical symptoms. What does it mean? Simple, if I tell a word, that is exam fever. Okay, for example, you are having exam tomorrow. Okay, tonight you will have a fever. Yes, it happens with all. Okay, so what is that? Means we are having a stress. The stress is exam. Okay, that stress we are expressing it in a physical symptoms as fever. Okay, so that type of defense mechanism is known as conversion. Okay, so defense mechanism, one of the main topic in psychiatric nursing. We'll be discussing all the defense mechanism with an example or questions whichever come like this, we'll discuss in our further videos. Okay, then total score of MMSC. What is MMSC? Mini mental state examination. Okay, what is mental status examination? So for example, an individual is there. If we want to assess the physical status of the patient, or individual, we have certain parameters like height is there, weight is there, pulse is there, BP is there, temperature is there. Okay, heart sounds, lung sounds. Okay, reflexes is there. Okay, Snell chart is there, and hearing is there, turning fork experiment, like that many we are having. Okay, these things are denoting the physical health of the patient or physical status of the patient. Okay, like that we are having something which denotes the mental status of the patient. Okay, that particular thing is known as mental status examination. Okay, so total score of mental MMSC is 30. Mental status, mini mental status examination is 30. Okay, we'll see what is components of mini mental status examination. It is Oracle. Okay, the mnemonics we use is Oracle. Okay, orientation, registration, attention, concentration, language, emotion or recall. What is orientation? We'll ask the patient, where are you, how are you, okay, where you went there, like that, okay, that is orientation. Then registration means how far he has a memory power, okay, that is registration. Then attention, either the patient is having an eye to eye contact, okay, either he is listening to us, okay, concentration, he is listening to us or he is not listening to us. Then language, whether he can tell what the words we are using to tell, okay, either he can able to communicate, okay, that is known as language. Then emotion or recall, we'll tell some certain things, and after 2 minutes or 3 minutes we'll ask the patient what I told that time, they have to repeat it, that is known as recall. Okay, so that is these 6 component is known as mental status examination. Here the total score is 30. Okay, normally suppose if you check for us normal, for a normal individual it will be 25 to 30. Okay, if suppose they are having mild to moderate impairment, then it will be 18 to 24. Then if their impairment is so poor, then it will be less than 70. Okay, so coming to the next question. According to Erikson psychosocial theory, a person aged 45 years develop which of the following crisis? Okay, I hope you everybody are well versed in Erikson psychosocial theory. Okay, so options are industry versus inferiority, intimacy versus isolation, generativity versus stagnation, identity versus role confusion. So the answer is generativity versus stagnation. So to answer this question, you should know what is Erikson psychosocial theory. Okay, so what Erikson did, he divided a person life into 8 stages. Okay, among these 8 stages, he given one aspect. In this stage the person will be like this, in this stage the person will be like this, in school age the person will be like this, in old adult the person will be like that. Like that he has given some stages. Okay, what are the stages? Trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, industry versus inferiority, identity versus role confusion, intimacy versus isolation, generativity versus stagnation, integrity versus despair. Okay, so trust versus mistrust in infant period, in toddler period they develop autonomy versus shame and doubt, in preschooler they develop initiative versus guilt, in schoolers they develop industry versus inferiority, in teenagers they will develop identity versus role confusion, in young adult they will develop intimacy versus isolation, in middle age they develop generativity versus stagnation, in older adult they will develop integrity versus despair. What was our question? A person of 45 age. 45 age will be middle aged adult, right? So they develop generativity versus stagnation. Okay, so if we come to the exam point of view, they won't ask the infant's stage psychosocial stages. Okay, they won't ask toddler psychosocial stages. Most of the MCQs came in these 4 I's. What is 4 I's? Intimacy versus isolation, identity versus role confusion, industry versus inferiority, and initiative versus guilt. These are the 4 major stages where the MCQs have came till now, because we people get confused, right? That's what the examiner also want. So please read it clearly. Okay, which stage, which one? Okay, in preschooler initiative, in schooler industry, in teenager identity, and in young adult intimacy. Okay, so these 4 stages have been asked in many of the exams. And another thing asked is generative versus stagnation. I already told. Okay, that was the question we are discussing now. Then in older adult means more than 60 years they develop integrity versus despair. Okay, coming to the last questions of today's video. The term used to denote delusional belief that other person is deeply in love with him or her is known as. Okay, so what does it mean? The term used to denote delusional belief. Okay, I already mentioned my first question in this video was what is delusion, right? So that question is repeated now also. Okay, Delusional belief that other person is deeply in love with him or her is known as. Suppose consider me as a person. Okay, that person. I am having a thought. Okay, like some person is in love with me or some famous personality is in love with me. Okay, that delusional belief is known as option A confabulation, option B erotomania, option C folie et deluxe, option D realization. Okay, so I will give you a cheat code how to read psychiatric nursing. Okay, there are 40 or maximum 50 terminologies is there. Read those terminologies and you should have an idea which disease condition, which terminology we should use. Okay, that's all. Entire psychiatry is over. Okay, if you ask me what is the basics for psychiatry nursing, I will tell terminologies. Okay, if you are well versed in these terminologies, you can answer very well any of the psychiatry related questions. Okay, so the answer for this question is erotomania. What is erotomania? Delusional belief that I am having some affair with some famous personality, that is known as erotomania. Okay, that's all about today's questions. Okay, I have already given one assignment. What is the difference between mood and affect? Okay, so second assignment is what is the term folie et deluxe? Okay, let me know in comment box. Okay, so if you comment the meaning for these two terminologies, I will be so satisfied. Okay, the more you comment, the more you share the videos, the more you like our videos, that is my reward. Okay, so it make me more enthusiastic to do more videos, and it helps me to guide the need for you people, means for your viewers. Based upon that I will make my videos. Okay, so if you are new to our channel, please subscribe, like our videos and share this video among your friends. Thank you so much.